very good evening, all. I'm Aditi Lamba coming to you from a remote location in New York City. Welcome to Wednesday night's Vision of Asia South Asian news segment. This is our ongoing report on the coronavirus pandemic. Hope you're all doing well and staying safe and inside. Nearly 3.7 million cases of COVID-19 globally, with at least 258,000 deaths. New genetic analysis speculates that COVID-19 was in circulation among people long before it was recognized, and that populations could have already built up some immunity. The World Health Organization today warned of the risks of returning to lockdown if countries emerging from pandemic restrictions do not manage transitions extremely carefully and in a phased approach. In the United States, there are 1.2 million cases of COVID-19 and nearly 72,000 deaths. The New York remains epicenter. While this is happening, at least 43 states are completely or partially reopening by this Sunday. If you are in a state reopening, please write to us with your experience on events@itvgold.com. Also connect with us if you are a South Asian on the front line. Now, coming from New York City, for the first time in a century, the subways shut down last night to disinfect and clean the stations to prevent further spread of the novel virus. Here are some pictures. With that, it's now time to begin the episode for tonight, featuring officials from Georgia on reopening and more on volunteer efforts, as well as updates from doctors. Here are the headlines. State Representative Angelika Kausche on reopening, economy, COVID-19 in Georgia. Dr. Dixi Patel on frontline experience and COVID-19 developments, New York City. Akshay Patra Foundation hosts Virtue Gala, tackling COVID-19 crisis, featuring Indian actor Paresh. It's time for a short break on Vision of Asia, Voice of the Community. Come back to us. Welcome back. I'm Aditi Lamba. This is Vision of Asia, special report on coronavirus impact, measures, and updates. Beginning the episode, let's take a look at our recent interaction with Georgia House District 50th State Representative Angelika Kausche, who joined us for a virtual conversation on the much-talked topic of reopening of Georgia and its impact on the spread of the novel coronavirus. Talking very openly about the concern of increase in number of COVID-19 cases in the state of Georgia, Representative Kausche asked for more protections for residents, PPE supply for hospitals, and a need of increase in antibody testing. Also reflecting upon the economic crisis as well as the education system, Representative Angelika Kausche provided resources and other opportunity for members of the community that are struggling in this pandemic. A very political perspective on COVID-19. Here is Representative Kausche.
What is your take on antibody testing and all of the information that we keep on hearing on a national scale about it?
Well, interesting that you mentioned this, because my husband and I, we are both part of a clinical trial for antibody testing. So we took our first round. It's a quantitative test that basically really counts the antibody in your blood. I'm not a medical person, so I probably don't say it correctly, but we just got the quantitative test results, and both of us have high antibodies in our blood so far, and we're going to go back and revisit this, probably go for another test in 2 months. And antibodies are helpful as long as we can establish where the threshold is for perceived or for known immunity. We now know, by husband and I, we now know both that we have antibodies, but we really don't know yet whether this means that are we immune, or are we immune for now? What will it mean in the fall if there is, or later on, if there is second surge, can we get reinfected? At this point, right now, we are very confident that we are in a very safe space, but we don't know yet how long that safe space lasts. If it's like the regular common cold, you know, we get that every year and there's nothing we can do about it. We just get a cold. So if that's something like the coronavirus is anything like that, and we are not able to develop a vaccine quickly, then dealing with this disease will take a long time. And as I said, we need to do way more research.
Definitely. And, Representative Kausche, your district, contains some of the highest number of South Asian Americans in the state of Georgia. And, we are a network of South Asian American community. I would love for you to address them that are living in Georgia. Some of them are really concerned about, again, the state is reopening and the number of cases are on an incline. And also, what are some of the resources that have been available, for South Asian American communities there?
Well, as you're right, in my district is one of the most diverse districts in Georgia, with a very high percentage of South Asians and Asians, and many of them may work in the medical field. We have a lot of healthcare workers in my neighborhood. I have several South Asian doctors, physicians. So they are concerned, especially because many of them work on the front lines and it directly affects them. We know that frontline workers are the 10% higher risk to get infected than anybody else because they are exposed to COVID-19 at a much higher rate. So are very concerned about bringing back this virus back to their families while at work. So opening up increases that risk because they fear they will see more patients. But there are also other concerns that the resources in our district directly are fairly good, the medical resources. We have a very good hospital around the corner. Lots of physicians here in the area work there. We have good schools. We have just opened, the Department of Health opened a testing site in Johns Creek. So in terms of access to resources to address COVID-19, I think we're in a fairly good spot here. I know that, for example, hospital capacity in our area is still there. Actually, some of the hospitals complained that, not really complained, but said we're actually glad that the reopening would allow them to do elective surgeries again so that they could go back and do some regular work. But the concern is there that we just stretch out this virus so long that it affects us for a very long time, and that will put definitely strain on the healthcare community and all the frontline workers.
This kind of brings me to this national dialogue about racial disparity that we've seen in different states. We are, coming from New York City here, we've been really badly hit by racial disparity while the cases are increasing here as well. Your comments on what is happening in Georgia in terms of racial disparity, and when we're talking about the Black communities or the brown communities, what are some of the challenges that they are facing?
Well, this is definitely true in Georgia too, but what we need to go back to is it goes back to testing. So far the data we have is not conclusive enough. I know it affects the African American community disproportionately high. They have the highest number of cases and the highest numbers of deaths, and then the Latino community is affected. For the Asian and South Asian community, I have not really seen a lot of data. It says how it directly affects them. So I would say we need to do more testing and we need to do more data recording to really see how it affects our communities in terms of race. But also when we talk about racial disparities, it goes back to healthcare in Georgia. And we have seen racial disparities for a long time. We are one of the states that has the highest number of maternal deaths. We have counties that don't have a pediatrician. We have counties that don't have a doctor, or counties where people really don't have access to a hospital because the rural hospital closed down. You take all this together, and then you have all of a sudden a pandemic like this. This pandemic amplifies the disparities are there, and they really brought them up to the forefront of what is causing these problems. So for the future, I would hope that we take the experience from what we're having now and really strategize how we can better prepared and become more resilient to address a crisis like this if it comes again, or if it persists or pertains longer.
Right. What is needed on a state or perhaps even a local level to help the health crisis as well as the economic crisis? They're kind of going hand in hand right now. And there is no way to sort of, separate them. According to you, what is needed right now? You are, working for District 50th, and there's so much being talked about. What is your take on it?
Yeah, thank you for bringing up. And you basically say something that I like to say a lot is I really hope that this pandemic brings out that we cannot separate economic well-being from health well-being, because it's really intertwined and interconnected. We cannot have one without the other. What it means, for example, for the economic development is this, bringing it back to the South Asian community. The South Asian community, we have a lot of business people here. They have small business owner. We have a lot of South Asian, especially Indian restaurants, and all of them are struggling. Some of them tried to get SBA loans, but may not have been successful. So they're trying to get by, especially the restaurants with takeout business. But there's only so much time. They only can do it for so long until it really goes to their bottom line.
Presenting tips and measures coming in from South Asian medical professionals, we now have another conversation with Dr. Dixi Patel in New York City. Today, New York Governor Andrew Cuomo said that the state's total hospitalization rate is down again, but added that he would like to see a steeper, faster decline. At least 232 people died across the state of New York from COVID-19 yesterday, according to the governor. Bringing her perspective on these numbers, Dr. Dixi Patel shared her frontline experience in epicenter New York, giving tips and measures to stay safe as well as healthy during this pandemic. Dr. Patel also urged all to maintain social distancing and applauded the efforts of healthcare workers all across. Here is the story.
You know, we have been talking about flattening of the curve and what happens after that. But now that there is this, basically this fear of a resurge of COVID-19 cases and also of it coming back again in fall and in winter, what is this curve currently looking like? And what are we looking at right now while these states are reopening?
So I think it kind of varies, but I think for the most part, it just kind of depends. I'm in New York. So in New York, we kind of hit it early on compared to some of the other states. We were the hardest hit and we got the most affected. So, we have the most deaths and everything here in New York. So I think for us, we hit our peak like a couple of weeks ago. And now we've started to see a downtrend. So we are starting to see less cases. We're starting to see less deaths. We're having more discharges. So we are actually starting to flatten a little bit. Now we are at this plateauing phase right now. I know certain other states are just now hitting their peaks. So they're still up here. They haven't quite come down and hit their plateau. So they haven't quite flattened yet. But I think it's, it's just each state is going to kind of have its own flattening situation. So I think New York is definitely flattening its curve a little bit now. We haven't opened up yet. We're still on lockdown. I think they were projecting May 15th to reopen, but I think again, with reopening, it has to happen in phases, and it needs to happen, slowly. So, that's just a projection. I don't know if we're actually going to reopen May 15th, but the fact that we are seeing a downtrend, that we are seeing a flattening effect here in New York, kind of just reflects that, hey, maybe the social distancing has been working a little bit.
Right.
But yeah, we are scared, about a second surge as soon as we reopen. There is a possibility that there's going to be a second wave. I think the main thing, though, is to make sure it's not as bad as it was the first time. The first time we were not prepared. We didn't have the equipment. We didn't know how to handle it. Now I think because we've already been through it and, we kind of got we got the whiplash of it, already early on. So I think now we are hopefully a little bit better equipped and a little more prepared for that. Hey, if there is a second surge, it's probably going to happen, but hopefully it will happen, in a staggered fashion and not just everybody at once,
From a medical perspective, what is required for reopening, especially for an area like New York City? We both are, filming from there right now, as well as we speak. What do we need here for the state to reopen?
So I think as far as reopening, I think we just really need to make sure that we are kind of at this flattening phase. For example, it's only been like a week and a half that we've actually been seeing a downtrend of things. Right. I don't know if that's quite that's quite really confirming, or reassuring that, hey, yes, let's reopen now. I think we need a little bit more time to make sure and just make sure that we are still kind of staying on that path. to where we can say, okay, maybe social distancing has been working, or whatever. Maybe we had a big surge of cases and now hopefully everything's kind of calming down. But I think we need a little bit more time before we can say that, hey, we're ready to reopen now. And even then, like, I know obviously the economy is taking a huge hit, but I think when we do reopen, it does need to happen in phases, and smaller businesses first. And then even then, I think everyone still needs to take precautions. So still kind of adhere to the whole social distancing thing. I still think wearing masks in public, I think that's still something that we should be doing regardless. And I think just in general, like, everyone should just take their own personal precautions for their own lives, right? Like, if they want to protect themselves, the smart thing to do is to wear a mask when you go out, is to keep your 6 feet distance. Try not to be in large gatherings. And I just think this is something that we just need to, like, this is our new norm now, So yeah. I think this is just something that we need to adhere to for at least the rest of the year, just kind of keep this in mind, just make this our new routine and just go forth that way.
Yeah, quite a point you said right there. It is the new norm, the new normal as we're talking about. Let's talk about the virus a little bit real quick. What are some of the latest developments you have seen yourself? I know you're working on the front line. You are around COVID patients. What have you found so far? What are some of the alarming facts or some of the things that are concerning all you doctors right now?
So I think one of the things is, we're obviously trying to figure out how do we beat this thing, or, we've tried different things. There's hydroxychloroquine, azithromycin. There's all these new things that have come out that we've tried. And there have been different studies that have shown certain things to be effective and certain things to not really be as effective. But it has been very variable. So it's been very patient specific and things like that. So for many cases, yes, hydroxychloroquine has worked. A lot of times we're just kind of throwing everything as much as we can to see, right now we don't have anything confirmed that's like, okay, yes, this is the treatment. So at this point, it's just been a lot of experimental stuff and just trying things and just doing as much as we can and throwing on as much as we can just to see if, hey, any little bit of this might help the patients.
Time for the short break on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. This is Vision of Asia, Coronavirus Pandemic Special Report, and I am Aditi Lamba. Popular nonprofit Akshay Patra Foundation has served over 5 million free meals to marginalized communities in India since the national Indian lockdown on March 24th. This effort is helping migrant and wage workers of India, where Akshay Patra is working with the government of India to provide relief during COVID-19 crisis, tackling the problem of hunger in vulnerable communities. The foundation, whose mission is to provide education through midday meals, is hosting numerous virtual events to help relief efforts in India. Recently, a Boston chapter virtual gala was held with messages from Akshay Patra's youth member body, CEO Vandana Tilak, and popular Indian actors Paresh, Rawal, and Swaroop Sampath. Here is the story.
Welcome to Akshay Patra's first virtual gala, the Boston Virtual Gala. We are joined by 1,000 families in this meeting, as well as a few hundred more on Facebook Live. It is indeed heartwarming to have friends like you joining us year after year, rallying behind the good work we do, and encouraging and motivating us. Thank you for being here tonight with us. In the year 2020, as events quickly went online, one thought came to our mind. However, are we going to raise funds when in previous years everything had been done through 25 events all across the US with the help of amazing chapters? Well, the answer came to me this morning with just one word, and that word is trust. The trust when millions of Varkaris or devotees walk hundreds of miles seeking for something that means something to them. When 1.8 million children come to school to make sure that they are able to study, and 1.8 million parents trust that we will make sure that there is a meal provided for them in school, that trust is what we wish to uphold tonight and every year as we move forward with a firm commitment to not just feed 1.8 million, but 5 million every single day.
Akshaya Patra, the unlimited bowl of abundance and sustenance, founded in 2000 in Bengaluru, India, began serving 1,500 meals to a small group of school children. The organization has grown to become the world's largest midday meal program to alleviate child classroom hunger.
क्योंकि खाने से हमें कई प्रकार के विटामिन, प्रोटीन वगैरह मिलते हैं और उससे हमें मानसिक का जो हमारा दिमाग होता है उसका विकास होता है, ऊर्जा मिलती है खाने से हमें.
There is no better expenditure of money, and it's really important for these kids to stay in school and to learn. So I love this program.
Giving that comes from a place of abundance is spiritual. Children have infinite potential.
In this extraordinary effort to feed the hungry children in schools by contributing whatever you can.
Living in America, I never have to think twice about basic aspects of my life, such as food or education. If I'm hungry, I just go to the fridge. If I want to learn, I just go to school. I never have to put one over the other. I've always been aware of the poverty in India, but I never knew how critical it was until I came across Akshay Patra. Their method of providing free meals in school is intelligent and creative, and is what sets it apart from other organizations. Realizing that I can make a difference in these kids' lives even though I'm 8,000 miles away is what encouraged me to join Akshay Patra.
When I was 6, my family took me to an orphanage in India. I didn't know there were so many kids living in poverty. I knew I needed to do something about it. I told my parents that we needed to go back to the orphanage to donate a few things to them. We donated coloring books, markers, pencils, and all the basic things that I would want if I were a kid. The whole experience was unreal. It shocked me to see how many children in India didn't have enough resources to live.
My family and I visited a kitchen in Bombay. It was an incredible and eye-opening experience. We first got a tour of the kitchen and learned how the nutritious food was prepared in large quantities. But the best part for me was when my family and I went to the schools to actually serve the meals to the children and spend time with them. It was amazing to see how happy they were to be able to receive these meals and meet us.
I vividly remember walking into the facility and being amazed by the size of the kitchen. I noticed how all the food that was being produced was made by hand, and that all the people involved in the production of it were working hard as if they were cooking for their own families.
It was soon to be my 7th birthday, and like any 7-year-old, I was really excited. My mom had been volunteering for Akshay Patra for a couple months before, and she suggested that on my birthday, instead of getting presents, we should have people donate the money they would have used to buy a present to Akshay Patra. As a 7-year-old, I really didn't know what to make of this, but it taught me a valuable life lesson. To always help people in need, and always try to give back.
By helping this foundation, not only would you be able to bring countless children joy in India, but you'd also be able to experience that feeling of joy yourself.
I am very thankful that I'm able to be part of a group that helps many impoverished kids get nutritious meals every day. Throughout the 6 months that we've been together, I have learned leadership skills, how to work with a short deadline, and a new way of looking at the world. I learned that we should appreciate what we have given and if possible help others who don't have that same life.
I first got my idea for a vending machine after coming back from a trip to India, visiting one of the schools Akshay Patra supports. I convinced my dad to let me get a vending machine. Along with snacks and drinks, my vending machine also displays a banner showing people how their money is being spent to feed and educate kids all over India. I am positively sure that there's many other kids all throughout America who can come up with their own ideas to support Akshay Patra. So please, join the Akshay Patra community to help make this profound difference. Thank you.
नमस्कार, मैं परेश रावल। अक्षय पात्र बॉस्टन चैप्टर वर्चुअल गाला में मैं आप सभी का अभिवादन करता हूँ। बॉस्टन का नाम सुनते ही मेरे मन में टनाटन होने लगता है। बॉस्टन टनाटन, क्योंकि यहाँ पे मेरा दोस्त चंदू शाह, ईशानी शाह रहते हैं। मैं यहाँ पर मिस्टर देश पांडे को मिल चुका हूँ और मैं आप में से भी कई लोगों को मिल चुका हूँ जब मैं मेरा ड्रामा का शो लेकर आया हूँ। और मेरी नज़रों में बॉस्टन का ऑडियंस वेरी शार्प एंड इंटेलिजेंट ऑडियंस। तो ऐसे बॉस्टन से अक्षय पात्र वर्चुअल गाला को सपोर्ट करते हुए मुझे बेहद खुशी हो रही है। मुझे मेरा एक डायलॉग याद आ रहा है कि इन बच्चों को भगवान के भरोसे छोड़ने पे मजबूर मत करना, क्या पता भगवान आपके भरोसे बैठा। तो अक्षय पात्र जो काम कर रहा है उसके लिए मैं उनको वंदन करता हूँ, मुबारकबाद देता हूँ, धन्यवाद देता हूँ।
I would like to say something about Akshay Patra. I am a huge fan of the work they do. I work in the villages in India and I see the direct result of their work. They make the most healthy, nutritive and very clean meals for our children. Thank you, Akshay Patra. Because education on an empty stomach, I don't think that works. So thank you, Akshay Patra, for everything you do for the children of India.
This wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us this evening from New York City. I'm Aditi Lamba. This is Vision of Asia. Take care. And